My name is Dr. Jordan Harris, LPCS, LMFTS, and I help therapists do two things: to get unstuck with really hard cases and to increase their retention. And I do this by teaching therapists four foundational skills. These skills, if you think of your model as sort of the car, these skills are the gas that make your model run. And these four skills are: one, assessing client motivation; two, therapist persuasiveness; three, reading client body language; and four, helping clients to access their inner world through client experiencing. And today, we're looking at the skill of persuasion in the work of Dr. Tori Olds as she works with a woman who's going through a midlife crisis. A quick note, this is not our actual client. This is a demo that Dr. Olds does with her sister for training purposes. So with that said, let's dive in.
Here. Okay. So is it spread throughout your chest? Is it in a tight little ball? Just kind of notice what it's
Kind
like.
of like tighter, like right in the
Right in the
right there.
right in the middle.
So persuasion has sort of two big parts. The first big part is body language stuff. And the big idea with the body language stuff is you want to make sure that your body language conveys that you're really engaged with the client. And you can see that with Dr. Old, that she's sort of pantomiming what the client is doing, right? So the client is sort of talking about her, this feeling she feels right in her chest. And look at Dr. Olds' hands. She's doing the exact same thing. This is a very basic way to convey to somebody that we're engaged with them.
Okay. All right. So we're just going to put awareness on it if you're willing for a moment.
Okay.
Yeah. Tension, I think of it not so much as the feeling itself that we're wanting to go toward, but as like a response that's pretty common. I think it's like a straitjacket around the feeling. It's like when we have a feeling and some part of us is like, oh, I don't want to feel that, like kind of pushes it in or constricts around it because it's maybe not comfortable or, what I mean? That makes sense a little bit.
Yeah.
So that could be our clue that there's just some hesitancy, in your system, and we want to honor that toward feeling whatever this is. But we also want to give it a little time to at least be able to shift.
Okay.
So if you're willing to just notice the tension,
Okay.
just bringing that, being curious and just watching it and just see, we're just going to see if it might shift with just a little awareness. So tune in just.
So this is the other part of persuasion. And persuasion is one of those topics that I want to talk about. A lot of therapists get very antsy. They don't like it. And I think rightly so, because persuasion so often is seen as coercive. And I am not about coercing or pressuring anyone to do anything. That's not what I want I have no patience for any of that. Um, instead of, but what I do want is to motivate my clients, right? I want them to adopt new ideas, right? If I'm working with a woman who's struggling with depression, I want her to adopt a new idea that the future can be different than the past or the present. And so there's a level at which I want to motivate people. And what we know from the research on persuasion is that one of the best ways to motivate somebody is to give them a persuasive rationale, a reason, an explanation for um, doing something different. So the persuasive pattern basically is three steps. One, you understand the person's perspective. Then you wait for a charged moment, right? You offer a short explanation. And we basically see Dr. Olds do this in this clip here. Let's watch that again.
Okay. All right. So we're just going to put awareness on it if you're willing. A little ball. Just kind of notice what it's
Kind
like.
of like tighter, like right in the
Right
there.
right in the middle. Okay. All right. So we're just going to put awareness on it if you're willing for a moment.
Okay.
Yeah. Tension.
So Dr. Olds has this client tap into their inner world. The client says, I feel tense. And then, after she's having the experience, That's the moment when Dr. Old says, this is what tension is. She gives an explanation about tension. She gives a rationale for what tension is and why this client should keep putting her focus on her inner experience.
I think of it not so much as the feeling itself that we're wanting to go toward, but as like a response that's pretty common. I think it's like a straitjacket around the feeling. It's like when we have a feeling and some part of us is like, oh, I don't want to feel that, like kind of pushes it in or constricts around it because it's maybe not comfortable, or what I mean? That makes sense a little bit.
Yeah.
So that could be our clue that there's just some hesitancy, in your system, and we want to honor that toward feeling whatever this is. But we also want to give it a little time to at least be able to shift.
Okay.
So if you're willing to just...
So she gives this rationale. She says, tension often is our body's way of protecting ourselves from feeling something. And what that means is that whatever's underneath that is actually not being felt. Right? That's her rationale. But she gives it after the client has the experience. And that's what we mean by wait for a charged moment, right? You want the thing to sort of be live in the room. I'll give you another example. I often work with couples. That's who I see mostly. And I often will have a situation where, let's just say I have a husband who's really angry with his wife. And he'll go off about something, right? And then at some point I'll stop him and I'll say, oh, is this what happens? Is this what happens? And he'll sort of stop and he'll be like, what do you mean? I'm like, well, it would make sense to me that this is why you're getting stuck, right? Because you're saying that you're really hurt that she asked you once again about the budget, like she doesn't trust you. But what we see in real time is that you get really angry. And so I can see how this would get you guys stuck, right? If you're really hurt and there's a deep belief for you, a deep sense that she doesn't trust you, but what she sees is anger, and then she's going to withdraw, probably, or at worst, fight back, right? Which is just going to confirm to you that she doesn't really trust you. So then you get more angry. No wonder you guys are having trouble figuring this thing out. Can I help you with this? Right? That's my way of giving them a rationale, a reason to do something different. It's a short explanation of what's happening, but I'm using what just happened in the room. This is very different than psychoeducation. Psychoeducation basically is I come in and I give you a bunch of information and I say, what do you want to do? And the idea of the persuasive pattern is the persuasion comes after the moment, right? It comes right after the moment. The persuasion comes when the thing is live in the room. And that's a big difference. We don't just come in and say things all willy-nilly, right? We don't come in. I mean, there is a benefit to psychoeducation and consent. Totally very useful stuff. But when we want to help people sort of shift these really stuck emotional patterns that they suck into, we want to do that like right after they sort of had the actual experience in our sessions with us.
Just notice the tension.
Okay.
Just bringing that, being curious and just watching it and just see. We're just going to see if it might shift with just a little awareness. So tune in just to that spot.
Okay.
Just give it a little time to be noticed. Yeah. As you're with it, you may even sense, like if you notice the tension, just see if you can feel a little, like what's under it.
Under.
Yeah, like if tension was around something, so like we want to feel inside, like what it's tensing around. Another way to ask that might be, if you weren't feeling tense, how would you be feeling?
Okay. Yeah, I can almost as you said that, I kind of felt like it really actually under it is weird, kind of like this dream of maybe like sadness. Like it
Okay.
almost went like,
Like
I
a
don't know, I
stream
felt
of
like a
something.
down,
Okay, down. Okay.
I felt like more down and bigger feeling.
Okay, so stay with
I
that.
think. I don't know if it's sadness.
Well, take a second. Yeah, I love that you could track it in your body. So
Okay.
feel it first and just,
Okay.
you had a sense it may feel like sadness.
I think I thought of sadness because it felt just sort of heavy under the tension.
Sadness
Sort of heavy.
often is heavy. It really often is. So just be with it and see what that's like.
Okay. So just keep noticing it?
Yeah, is that okay? Does it feel okay
Yeah,
as we're doing this to be with that? Okay,
yeah.
good. You're doing great.
And then she just follows it up with a lot of validation and affirmation, right? Which makes sense. I think this is probably really even tender for this client to even name, you know? And so to give them some support after that and validation helps them to stay with the experience and continue to exploring it. So this is a version of persuasion in the work of Dr. Tori Olds, working with a woman who's stuck in a midlife crisis. If this is interesting to you, if you like this sort of training, feel free to go down below, sign up for my newsletter, and you will get more of this sort of training in your inbox at least once a week. All right, see you in the next video.